Okay, hello everyone. I hope everyone is okay. So today we are going to be talking about acute pancreatitis. So first of all, what whenever you hear the word itis, it just means inflammation. It just means inflammation. So for example, enthesitis, which is inflammation of the tendon at the insertion side. There can be like dactylitis. There can be gastritis, which is inflammation of the gastric lining or mucosa. So whenever you hear the word itis, it just means that it's that there is an inflammation going on, and now in this case this is pancreatitis, so it just means that the pancreas is inflamed. So first of all, we should know like what pancreatitis is all about, like what's the definition of it is, and it's usually it's usually defined as the autodigestion of the pancreas. So now, what autodigestion means is that the pancreas kind of like eats its own self, and so in order to understand what that means, you have to know a little anatomy of pancreas, and so now a pancreas is located in the epigastric region, and so epigastrium is just kind of below your ribs, the rib cage. So this is the lower lining of the rib, for example, and then we have the esophagus coming here, and then we have the stomach, and then there's a duodenum, and the duodenum here we get the snake-like structure, and this is the pancreas, and the duodenum kind of just circles around it. And so this is the pancreas. So this is in the epigastric region, and the epigastric region is kind of like that is where you're gonna find the pancreas. And so now another thing that we should be aware of is what the autodigestion kind of means, how it eats its own self. So in order to understand that, we have to understand a little more of the anatomy. So so normally we have like the bile ducts that are coming down. So the bile ducts are coming down here like this, and then this, and the pancreas is kind of here. Let me just make the pancreas. The pancreas is here. The pancreas has kind of like its own duct, and this is, I'm obviously just making a really rough diagram. And this is the cystic duct, and this is the gallbladder, and then above it is the liver. Okay, this is the liver, for example. So now this is the common bile duct. This is the gallbladder, and so it will come here. This is the common bile duct, and it will combine or merge with this, and then it will go like that. And here we are going to have the intestine, or the what is that called, the duodenum, and so it is going to open up here. So now, so this is a little anatomy that is really important to kind of like know. So the pancreas, it kind of makes a lot of like enzymes, and the enzymes, these are digestive enzymes. But if there is an obstruction here, for example, a stoner is formed here, and it is small enough to pass through the cystic duct, it will come down to down the common bile duct, and it will obstruct the outflow of it can also obstruct the outflow of the bile. But right now we're not talking about those areas; those are more complex. So we're talking about the pancreas. So now it is obstructing the outflow of the pancreas, so that all the digestion enzymes are going to build up here, and then they're going to get activated, and then they were going to eat. What do digestive enzymes do? They break down things, right? They break down foods, which can include pancreas, and which can include protein. Sorry. And the pancreas, the pancreas. One of the substances of the pancreas is made of is proteins, also fat, and also other things like carbs, and it produces all of those enzymes for digestion of enzymes, so it will digest the pancreas. So now, this is just what the basic idea about the pancreatitis is. And so the first cause is the gallstone that we already talked about. The second cause is the alcohol. Alcohol is just, there are a lot of things, a lot of mechanisms by which it destroys the pancreas. One of the one of the mechanism is just direct toxicity. The other is like it causes really thick secretions, proteinous secretion. It can block, which can block the pancreatic ducts, and it can result in pancreatitis. And so that is number second cause. So now the two most common causes we already talked about. So number first is the gallstone, and number second is alcohol. And these two together makes 80% of the causes of pancreatitis. So that's significant. So we should know that. Third cause, let's say idiopathic, and then other like hypertriglyceridemia. And hypertriglyceridemia will only cause pancreatitis when the TG, or triglycerides levels, are greater than 1,000. So that's another cause. Then there is hypercalcemia. Then there are drugs like thiazide diuretics. Thiazide causes calcium retention, so that may be the mechanism by which it causes the but there are lots of other causes like glucocorticoids can also cause it. So GLP-1 agonists, I think, are also one of the culprits, are one of the causes of pancreatitis. So that was about the causes. Then we come down to diagnosis. So how do we diagnose pancreatitis? So the way that it is diagnosed is through, number one, there is first we should talk about the clinical presentation. So now in the clinical presentation, so how will the patient present? The patient will present with epigastric pain, and the pain will be really severe, and it will shoot back. So it will radiate to the back, and it will be really severe epigastric pain. And with pain, we get tachycardia. So on examination, one of the signs is tachycardia because of the pain, and the patient will be in visible distress. Like you can see the facial expression. It will be like, it will just tell you that the patient is in pain. So the first thing when you come across that clinical presentation is to do lipase and amylase, and they will be in the thousands. Okay, so lipase is more specific. So when they are really elevated, that just suggests, and coupled with the common typical clinical presentation, that just should ring alarm bells that this is pancreatitis that you are dealing with. Others like ultrasound are done. Ultrasound is mainly because I said we talked about 40% of the causes are the gallstones, so we can actually find the cause there. And the perfect imaging test is CT scan. This is just perfect because it can just tell you a lot of the complications that can come with it. Pancreatitis, like necrosis. So then we have to come down to the management. The management is really conservative. It's just a nil by mouth. So the patient will be the patient should not eat anything by mouth in there for like up to 72 hours, and there will be IV fluids should be given to the patient. And if there is any infection or abscess formation, which the CT may show us, then IV antibiotics are given. And another rare thing that can be done when there is complication like necrosis is the necrosectomy. Okay, but this is really complicated, and not a lot of cases may need it. It's only when there is like necrosis. So I hope this was helpful. This was a short lecture just about pancreatitis. It was just a lecture off the top of my head. I didn't really prepare it. It's just what I learned in med school. So I hope it was just at least in a bit helpful. So thank you for watching.